Good afternoon. I'm Julie Keckstein. I'm happy to be representing the CMC board right now. I also spend my days serving clients in wealth management at PNC. Great to see everybody. Today's forum, housing challenges for the elderly. Where will the growing number of seniors live? It's an important conversation on aging, housing options, and affordability. And thanks to our sponsors, Cornucocosing, Porter Wright, and the Columbus Dispatch. And won't you please help me in thanking our sponsors and introducing Jack Beeler from Porter Wright.
Thanks very much, Julie. And thanks to all of you for braving the cold and coming out this afternoon and listening to some folks who are going to have really incredible things to say. Porter Wright's very pleased to support the mission of the Columbus Metropolitan Club. We've done that for many years because we believe it's important to keep the vitality of the community going by having a conversation. We're also really pleased to have represented National Church Residences for at least the past 25 years. My friend Tom Slemmer, about 45 years ago, was flying helicopters in Vietnam, ended up going to Ohio State, and his job out of college was to work for a man named John Glenn. But it's not the John Glenn that you may be familiar with. The Reverend John Glenn was a minister in Upper Arlington, and it was John Glenn's dream to found an organization that would develop housing for seniors in a prudent and a reverential way, a way that would provide dignity for that population. Tom grew up under the tutelage of John Glenn, and as during the last 30 years, National Church Residences has been a national leader in creative ways of building, financing, and operating housing, not just for seniors, but also for other disadvantaged populations. And it's not just housing, it's also supportive services, which you'll hear about today. Over the last 15 years, Mark Ricketts has grown up under the tutelage of Tom, learning many of the same lessons that John Glenn passed along to Tom originally. Mark left a successful career in the for-profit segment, and he's become even more successful in the nonprofit arena. And he's going to be taking National Church Residences to the next level while Tom retires to a farm in Delaware County where he and his wife Jody are going to be raising all sorts of squash and other interesting things. Tom's going to provide some opening remarks, and then Jane Scott, the president and chief executive officer of Columbus Metropolitan Club, will be sitting in for Mary Yost, who was ill and couldn't appear today. And so Tom's going to be sort of setting the stage for us, and I encourage you to pay attention because eventually we may be in need of their services. So, Tom, the floor is yours.
Well, I love the opening remark. Pay attention. So I see lots of my friends and colleagues and folks that we work with to build senior housing around the country. I think National Church Residences, Mark, now is serving 30,000 seniors around the country, with not only with housing and affordable housing, but with nursing homes, assisted living, home health care, hospice, adult daycare, and even more recently, First Community Village, really luxury senior housing facilities. I've been getting, over the last year, Mark's been elected as the incoming CEO a year ago, and so I've been getting a lot of people been asking me to say things, and people ask me, oh, you must have some wisdom over these 38 years. So now that I see so many people that know me, I'm not sure I can fool you all, but I'd like to acknowledge that the work I've done here for 38 years has been with an outstanding board of directors, and I have some of them here. Stand up, board of directors. We've had a long-term partnership. A long-term partnership with the Central Ohio community. Just think about the organization that's grown nationally to serve seniors in 28 states. Spring boarding right here from good old Columbus, Ohio. And I couldn't be more pleased with Mark. I met Mark in a parking lot in a church, I don't know, about 30 years ago, and I said, boy, he'd be a great young man to work for me, and finally talked him into doing it. So, and just think, we've been around since 1961, so over 52 years, and I just think there's a tremendous future for our organization. So where will all the seniors live? On Friday, my wife Jody and I were in St. Louis at what we call the last 202. Now that doesn't mean a lot to many of you, but The Section 202 program was designed to house seniors, low-income seniors, $23,000 or less income, virtually no assets, in a way that's really well-run and well-operated and well-built. And that program has been eliminated. And this is the last 202 that we're saying ever going to be built. Now, I hope not. I hope they revive the program, because what we're going to be able to tell you, I think, more in the question and answer period is that we believe that housing as a platform for services really is one of the solutions to some of the big problems facing our country. And people ask me about, what's the wisdom, what's going to happen here as Mark takes over the reins of National Church Residences. And I said, I think we have two really, really tremendous problems facing us. And the first one, I guess both of them you all know about, but the synergy of these two, I think, are going to create some really unusual problems for our country. First is the economic problem. You all have heard we have a deficit? And we also have a debt. We have to make choices, and one of those choices was to basically cut housing programs. And somebody said today that, if you were just thinking about the size of the deficit, not the debt, if you wanted to solve that problem by increasing taxes, it's a 50% increase in taxes. Well, or you could cut spending by 36%. Or you could wait and do it later, because some of these problems, especially with Medicare and Medicaid, are absolutely unstoppable. You could wait till 2030 and do it, and that's where you could cut spending 48% or increase taxes 64%. My prediction is sometime in Mark's reign at National Church Residences, we're going to solve that problem. And it's probably going to be choppy, and it's probably going to be scary as it relates to those of us that are providing care and services to a lot of older folks. Not only are we facing this big problem that I think we're going to solve here in the next 20 years or so, we're facing what is absolutely a tsunami of aging. And I'm one of them, and I look around the room, I see a couple more people that might be in that category. Not pointing anybody out, but I heard a guru say the other day that's the largest demographic shift anywhere in the world at any time in history. Anywhere in the world at any time in history. Well, I don't know if he's quite right or not, but it's a big shift. 10,000 seniors a day, right? People turning 65. And we're going to double the number of seniors over the next 30 years. So it's now like 43 million, and it's going to go up to 86 million in 30 years. Huge shift. And think about the way we finance health care for seniors. It's virtually all done through the Medicare and Medicaid program, right? That's what's driving the deficit. So you can repeat after me, the deficit problem is a health care problem. The deficit problem is a health care problem. I was with a think tank in Washington talking about how we're going to fund long-term care and supportive services for seniors as we go into the next couple decades. And around the table, all these smart people, and one of them was the executive director of the National Governors Association. He said, the governors have three priorities I see around the country: health care, health care, health care. In Ohio, 2.3 million people are on Medicaid, 40% of the budget, right? And you think about the ways we're going to solve this problem. Well, all of us want to solve the deficit problem. Our governor just came out recently, because we think he might be running for something later on, that he's for the balanced budget amendment. You think about all the problems we have to solve, cutting taxes, or cutting expenses or raising taxes to solve that deficit problem. Huge, huge problems ahead for all of us. And then you think about the economics of those seniors that are living in our facilities. I mean, many of us come from affluent families and live in nice houses. The average income of folks that are living in affordable senior housing, $23,000 a year. 30% of seniors in this country have a net worth less than $100,000. 30% have a net worth less than $100,000. Think about the cost of nursing care. It costs $60,000 a year in Ohio for a nursing home. So we have big, big problems facing us. If you live, we split the room down to half, and we say most of you think you're going to live to 85, but if you do, half of us will have dementia. Now, unless they come up with some cure, and I certainly hope they do. I've been forgetting a few things lately. But the cost of dementia care, and Mark is going to tell you a little bit about this in the Q&A, the cost is horrendous. Somebody said it's like 19 times higher, the cost of taking care of yourself if you have dementia versus living a normal life at 85. Big, big problems ahead. Most of us believe that Medicare is going to solve these problems, but the Medicare program is part of the deficit problem, and we're going to have to solve that problem going forward. It's not just about the 65 plus, by the way. We're going to quadruple the number of 90-year-olds by the year 2050. Quadruple the number of 90-year-olds. And the cost of taking care of somebody when you're 65 versus 90, just look at the statistic just for nursing homes. If you're in the 60s, only 1% need nursing homes. But if you're in the 90s, 30% need nursing homes. And if you're 100, 40%. And guess what? They claim now that when my father was born in 1902, that the average life expectancy was 47, and now it's 77 years old. And they say now if you have a child born today, it's 50% chance they'll live to 100. We're living longer, but not necessarily less expensively. And most people that really study this say most of us are not planning for the inevitable cost of care and services as we age. Well, we have lots of work that we're doing, 23,000 folks that live with us in affordable housing. They're all earning less than the median income of $23,000. 60% of the people in our nursing homes and others are on Medicaid. They've already run out of money. I mean, all our money, 60%. We're the largest provider of some of the things we're working on. We're one of the largest providers of affordable assisted living. And there's a program where you can take somebody that would otherwise qualify for a nursing home and serve them a lot less expensively in assisted living. We have also working on adult daycare, one of the lowest funded programs out there, and really help support caregivers so that they can take care of folks so they don't have to go in the higher cost of care. We're working on the dual eligible program where 50% of the people who live in affordable housing, almost 50%, are dually eligible for both Medicare and Medicaid. You know how you get in that status, that category? Old, sick, and really poor. And those are the folks that are really driving some of these huge challenges that are going to face our country over the next 30 years or 40 years. Housing as a platform for services, we think, is one of the solutions. And just tell you a couple stories, because we do a lot of supportive housing. How much time? When am I supposed to stop here? Anytime I want.
I'm having a good time listening.
So we do a lot of supportive housing. One of my career highs in working with our board of directors is develop supportive housing for the formerly homeless, right? And we have now 8 or 9 of those facilities. And we have a grant now from the state of Ohio and the Kresge Foundation to take 25 people at the Commons at 3rd in Grandview, a supportive housing facility for the homeless, directly out of nursing homes into housing. And think about that. Directly out of nursing homes into housing. There are 90,000 people in Ohio in nursing homes today. So one of the persons I met in the lobby, his name was John, and John tells me the story. How do you end up in this kind of situation? Well, if you're a marginal job and marginal in your bank account and you have a tremendous health care problem, in his case, he hurt his knee, had surgery, knee got infected, long story, in the hospital for a long time. And then when he's ready to get out, he has no place to live, and so he gets discharged to a nursing home. John lived in a nursing home for 6.5 years at the cost to the state of Ohio of $60,000 a year or more. This program basically allows people to move into supportive housing where we're able to provide some services like case management, and also we have a on-site nurse practitioner and a care coordinator. But just think about the savings related to housing as a platform for all kinds of healthcare success. It's really been a career high to see that, and I think there's lots more of lower cost solutions out there that our government needs to be working on as we deal with the vulnerable population, because a lot of this money is getting spent in the healthcare system. Last story before I quit is I met a young man at the Commons at Livingston, our 100-unit supportive housing facility for the veterans, homeless veterans out on Livingston and Barnett. And this is not his real name, obviously, but a young man, good-looking, well-spoken, well-dressed, and I keep thinking to myself, why is he homeless? I mean, he looks like he's got everything going for him. And long story short, after we get to know Darren, he tells us the story about severe post-traumatic stress after a couple of tours in Iraq. An emotional breakdown led to a loss of job and homelessness. 73% of the people in our supportive housing have chronically mental illness in their diagnoses. And he tells the story about how this stabilization of supportive housing with veteran services on site for health care and mental health care. And I was pleased to report that as of last Sunday, I was there with Huntington Bank folks. Thank you, Huntington Bank. And he not only did he get a job, he won the progressive car, and we're just really pleased with the kind of work we've been able to do, showing that the lower cost platform of housing can be really a platform for all kinds of success, be it homelessness, mental illness, or senior housing. So with that, turn it back to you. Thank you.
Thank you. Excellent. Well, thank you, Tom, and thank you all for being here. It's obvious that housing is very important to us. I mean, home is home, right? There's nothing like home. It's where our emotions live. It's where we raise our children and our families. It's where we go to in the evening to feel safe and secure. And I'm willing to bet that there's no one in this room can raise their hand to say that they're not going to be older tomorrow than they are today, right? Okay, so this topic is clearly affecting all of us, and I'm going to ask another question of you. How many of you have parents that you might be dealing with in the next 5 to 10 years? A few hands go up there as well. So thank you for sharing your comments. Tom, you've been in the business working with senior housing since 1976. And Mark, you've been in the area for 15 years. You've already talked about a few of these things, but can you tell us what you think the biggest changes have been? Maybe first, Tom, in your career, and then Mark, in the 15 years that you've been involved.
Well, I think the big change that we're all facing now is a complete change in the reimbursement system. So those of you that have parents thinking about this, it used to be that health care was paid for by Medicare, or in cases where there's some poverty involved, Medicaid. And now virtually all of those reimbursement systems are transferred to managed care, and almost all of our payer sources, Mark, are now coming from one of the healthcare providers. Completely different program, and I'll tell you, the healthcare providers are really demanding outcomes. So it's requiring us to be different kinds of operators, not just looking at caring for folks, but also looking at how we're going to make sure we have better outcomes.
I'll share with you a fun statistic. I was looking this week at the different payers that we have that would come into a nursing home or assisted living community. And we have 149 different payers that would pay us a reimbursement or a payment. You would say, that's not that difficult, but do you realize every single one of those payers has a different price? It's like walking into Wendy's and telling the person at the counter what you'll pay for that hamburger and having 149 people pay a different price. Somehow the organizations like ours have to balance that into an appropriate reimbursement to at least cover your cost, right? So that is the big challenge in the world we're facing. Every day somebody walks in with a different price for my hamburger. And it's a gigantic challenge. I will tell you that we balance that both with Medicare and Medicaid programs. We have all the conventional insurers that you carry in your wallet. If you're going to have a knee replacement and you need some therapy, you're going to come see us too as well. So it's a million different payers. That's the challenge. And all of them are narrowing their networks. What does that mean? That means that they're choosing only quality. If they're going to share a patient with me, if you're going to come stay with me, they want that patient to have the absolute best care. So if yesterday they would discharge to 10 different communities, tomorrow they're going to discharge to 2, the best 2. So the big change that's hit us is this unbelievable dynamic of reimbursement and the demand for the highest quality providers. And we want to be among that little select group of 2.
So do you see that changing in your time? I mean, you said you're going to narrow in terms of where they go afterwards, but are we going to have some price stabilization as far as what providers are going to?
No, I think it's more complex in the short run. I think I heard a quote the other day, and I just shared it with somebody, and that it's a quote from Wayne Gretzky, the hockey player, and it says, the point is to be where the puck will be, not where the puck is. So the question is, where's the puck going to be in the hockey rink, right? And I'm not sure we know, so we're just going to start skating, and you're going to be moving up and down that hockey rink hunting for that puck. It will land, and it will be at the goal. The question is, which goal are we going to? So right now, I'll tell you, if you're in the healthcare world, you're not certain. I think all of us that are playing in that space are innovators. We're bringing our own strategies in, all the primary care practices. Every hospital system is doing it, every managed care organization. There's a different name for every reimbursement that's innovation today. They won't all be innovators tomorrow. We'll land on 6 or 8 ways to pay for the growing cost of healthcare. But for the next 6 to 8 years, I think it's the nimble, those that are creative, those that focus on quality, they'll win.
So as this group gets older and the baby boomers go into the golden years, are we going to be healthier than our parents because we've been more aware of healthful living and taking better care of ourselves. So is that why we're living longer, as well as how's that going to impact the years while we're in
Can I give that one to you? Are we going to be healthier?
That one wasn't on the list, sorry, but that's where it's.
Yeah, one of the more uncomfortable truths is as we live longer, we don't live healthier. So you're going to be healthier at age 80, but at age 85, you're not. So the challenge really for us is how are we going to afford this escalating cost of, I guess you would call them care supports. You may not need an assisted living or even a nursing home level of care, but you just may need care within your home setting. Right. So we and our board spend a lot of time talking about the fact that most people, 90% of retirees, will never move into a retirement community or to an exclusively senior community. They're going to stay home. So a big portion of our thought pattern is how can we provide care support. It's not necessarily health care, but just assistance with living where you are today. I think we're headed there in a big way. I think we all want to stay home. I think there is a point at which you do need a higher level of assistance, and maybe a senior community is for you, or maybe you're fortunate and have the ability to pay for a luxury community like First Community Village, where the supports are just everywhere. But that's not going to be for everybody.
Talk a little bit more about that. I mean, housing is a continuum, right? So where does National Church Residence fit in that, and how is what you're going to be providing shifting?
Want me to tackle it?
Yeah, go.
Okay.
I think he's.
We're making a transition here. Can you feel it?
Yeah.
We've been on a tour for about a year having these speaking together, and I think we almost could speak for one another at this point. But I will tell you, at National Church Residences, we're all things senior. So once you hit the age 65, we kind of feel like we're on. It's mission on. So I wouldn't think there would be anybody in this room, whether it's your parents or you, as you need assistance, that you wouldn't be thinking about what we do. So I wouldn't want to exclude any of those settings for seniors. We want to be the supportive system for everybody.
But I think, and Mark said also that I think the statistic is 80 or 90% of folks will never leave their home.
That's correct.
So we clearly want to be involved in really outstanding home care with enough kind of residential health care support to provide for care for folks that need it at later stages of their illness. But I would, Mark said, what are some of the biggest changes going to happen? I think the biggest change that are going to happen as it relates to our reimbursement system is that there's going to be a constant cry to reduce cost. And for those of us that are on the provider side, trying to do that when most of your cost is in staffing is a real challenge. And so we are constantly looking for better ways of taking care of people. They're going to look for better outcomes. We're spending, by some estimates, twice as much as Western Europe are on an average on healthcare costs. So you can see that as we try to solve that deficit problem, we're getting a lot of pressure to reduce the costs.
And certainly some of that's going to be the more creative ways to keep grandma and grandpa at home, or moving in with relatives and things like that. That's a tough decision too, and let's face it, a lot of us wouldn't necessarily want grandma and grandpa to move in with us. I lived with Grandma Sloniker for 10 years, and it was interesting, to say the least. So how do we in this room prepare better for retirement and for the transition? I mean, you have typically in the past focused more on disabled and very low income folks, but that's not really all the conversation these days. It's people who have worked their whole lives, but it's expensive to get old.
It is expensive to get old. I could probably tell you a story that I think would impress you all. I'm a fortunate young man. I grew up in Upper Arlington, graduated there in 1978, had a wonderful family. My mother was a nurse at First Community Village when it opened some 52 years ago. I lived in that neighborhood, and my dad was a retired school teacher. He wasn't retired at that point. He was working. He worked in the Columbus Public Schools, was ultimately a principal, and then the director of vocational education downtown here over on State Street. So you would say, Mark, you're a silver spoon kind of kid, right? And I would tell you that I felt very fortunate, never did without. But at my dad's 80th birthday, we got back from a fishing trip, and my dad and I were standing at the garage, and he said to me, I don't know how to tell you this, but something's going wrong with me, and I don't know what it is. And we could tell we had been playing some card games while we had been fishing away, and I could tell his brain wasn't working quite right. Well, it turns out he was diagnosed with frontal lobe dementia. And you would say, well, here's two parents. My dad's a retired school teacher, so STRS retiree. has a full pension to look at, and my mom having a Social Security check as working as a nurse. And we're facing, and he said to me, but I'm set. I've got $350,000 in the bank, and I've got a pension. I'm set for the rest of my life. Well, I can tell you, when you get some forms of dementia, you cannot live at home. There are going to be cases where people need the kind of supportive system that we provide institutionally or need help at home. So we began to spend down my dad's retirement, or my dad's savings. He had his pension set up with STRS. And we went through that $350,000 in 5 years. I would tell you that's not enough, right? How many of us have $350,000 setting on the side for a health care risk or for dividing your household into two places? My mom and dad ultimately had to live in two different homes, right? Well, my dad's health care ate up the family wealth, gone, boom, and then he dies. Well, now my mom is living on half of an STRS retirement paycheck and about half of a Social Security check. My mother now qualifies to move into affordable housing from Upper Arlington to affordable housing. Now, she happens to own her house, and we can provide her the supports. Is your life so different than mine? Mm-hmm. It is a wealthy man's game when illness hits you as a senior. It is a big number. I would tell you that my solution is to buy a long-term care insurance policy because I know exactly the risk I face. And I would tell you that only 4% of Americans make that choice. And only 40% of Americans will qualify for the supports we call Medicaid. The rest of us are going to spend down like nobody's business. I would tell you it's like saving for college. We ought to all be making it a priority and be ready. Now, here's the good news. Only 4% of us will actually ever have to need the level of care my dad did. Only 4%. That's the beauty of insurance, right? If we all pay a premium and only 4% of us need it, that means that we're all going to be paying substantially less as a whole. So that's a big encouragement, I think, for all of us, especially in your 50s when you can still buy it. Now, when it comes to getting 70 years old, it's really, really expensive to go buy long-term care. So think early.
Okay, that's good news. I'm feeling a little better that there's only 4% of us that are going to need your services. I'm not feeling so good about the fact that my Aunt Mabel is 97 years old and still going great, which is good. That's good news, but it's just it bodes well, like I'm going to be around a long time. You've done a lot of work with the homeless and supportive housing and disabled, but as we were just talking about a little bit, the seniors that are coming to you now have different expectations. They lived in Upper Arlington. They had good meals. They had good restaurants. They had luxury. They played tennis. How are you dealing psychologically with how these folks are coming in and what their expectations are?
I'll take this one too, because this is my passion. Having grown up in Upper Arlington, virtually every family that lives at First Community Village is the parents of my best friends. So this is my career high. I can tell you, taking this community on because it's my backyard. I feel like when I walk, I actually live there today. I'm adding an addition on my home, so I decided to move in and just see what it feels like to be a resident. It's heaven on wheels, I can tell you. I've never had this luxury before in my life, but it's not hard to make the transitions because it's about caring for people, right? It's about being intimate with people, about hearing about their needs and filling them. So whether that person happens to have the ability to pay out of their pocket or whether or not we had to pull together the resources to provide them that care, it's not that much different.
I would say that on the lower income side of that scale, we're finding that the waiting lists are 10 people for every slot that is available. And so it's really, really difficult to get in affordable housing, quality affordable housing. And that's one of the mistakes I think our policymakers are making by cutting these programs that can provide so much support at a lower cost. So think about this. Mark was talking about his father, in the bank account he had. The average net worth, the median net worth of seniors, median, 170. Just think about it. Half of our seniors are not going to be able to afford anywhere near the kind of services and support that Mark's father got. So.
I would tell you 40%, I saw the statistic just yesterday, it was a Forbes Journal, 40% of retiring seniors don't have one penny in the bank.
More good news. So in a few minutes, you're going to have an opportunity to ask some questions, so be thinking about your questions, and I'm going to ask Tom and Mark a couple more, and then we'll move to the audience. Tell me a happy, good story about how you help. about how you help people transition. Because again, I mean, I look at my own family, and Aunt Fanny and Uncle Paul made the decision on their own to move to the Bluffton Memorial housing when they were still, I think it must have been in their 60s or 70s, and they made that decision on their own. It wasn't their children, and they lived a very happy life there because they had the time to develop friendships and a community there themselves. Talk to us more about,
Give you a happy story?
give us some happy stories about how you interact with the families and help them make decisions.
I'll let Mark and I can come up with lots of happy stories, so I'll take one, let him take another. I was at Canyon City, Colorado, just about a month ago for a reopening of a building. We've been operating affordable housing for 25 years. And again, the average person, the median income, you have to be below that, so you have to be below the poverty level of $23,000 a year. And Hazel came up to me and she says, I've been living there for 25 years. I'm 96 years old. It's the best thing that ever happened to me. So that's my story.
Let's see here. I think a lot about the preparing. So most of the people that come to First Community Village come in able-bodied, and they stay all the way to the end and never need that higher level of care. Only, as you get older, the percentages increase, but 4% at age 65. But at 85, it's 35% that need that assistance. But we consider it a victory when they go right back to where they were living, which would be either in one of our beautiful high-rise condominium or up in the manor homes up on the hill. And that happens more often than not. One phone call that happened here within the last 6 weeks, my mother's had a stroke. And you say, how can that be good news? Within 6 weeks, she regained her ability to read and communicate and walk and went right back into her home. That's great therapy. And that victory is much more common than the person who comes in and stays. We will see something in the neighborhood of 800 admissions in a given 2-month period of time, and 6 of those people will need to stay. That means everybody else is going home.
That is
Can I
good.
give you one more?
I suppose.
Okay. This is a story about somebody that's a near senior, but we do supportive housing, and we see lots and lots of folks that are in their 50s in supportive housing for the homeless. Brian Brown and the Metropolitan Housing Authority co-sponsored a facility for the formerly homeless, and a lady moved in. I'm in her apartment giving a tour with some dignitaries from Washington, and she tells the story about how she had a great job, a townhouse apartment, and a car. 3 or 4 episodes of diabetes. Brian, maybe you saw her, met her. And first thing you know, she loses the townhouse and sleeping in the car, loses the car, and is in affordable housing. But in affordable housing, where we have services available, you can provide enough support for somebody to manage their diabetes successfully. And you think about the cost compared to going to the hospital 3 times with emergency complications related to diabetes. So a great story there. So.
Those are good stories, and I know there are many other good stories, and many of us probably have good stories about our relatives as well. I have one other question for you, and then, as I said, we're going to move to the audience. You've touched on some of these things, but let's use this as our wrap-up. Mark, you go first. You've already said long-term care. What other advice would you have for those in the audience, either for those of us who are in our 60s or those of us who have parents that are aging? How do we prepare? What are the best things that we can do?
Education is probably the key thing. We get up here and we talk about terminology that we throw around because we've been living in it now for our careers. The terminology is rough. There's never a good time to study what Medicare and Medicaid mean, and Medicare Advantage in Part A, B, C, D, and F, and G, and all those. Or to understand what the Affordable Care Act means, but I would tell you, being educated on that and learning that and not counting on somebody else to do your thinking, I would advise you to jump in and learn. It is learnable. I came here 15 years ago and I couldn't spell Medicare and Medicaid. And today I feel like I can talk about it competently and at least help my friends. And if you want a primer on that, just call National Church Residences. We're all things senior. We'd love to start that process. We'll come back here and speak about the topic.
Wonderful.
Well, because I'm getting old, people call me when they have that kind of problem. I had a call last week. Somebody said my mom's been okay on her own, and now she has a little bit of dementia. What can I do? And the first thing I ask is, how much money do you have? Because that divides between those that need government support and those that can handle it in their home. This particular individual didn't have any money. And so when you have dementia issues and you out of money, the options are limited. And we were able to get her into one of our affordable assisted living facilities But the key is understand the resource requirement, understand the options that are available, especially with home and community-based services. And finally, if you need to get them into a facility that's supported by not-for-profit philanthropy or with government support, you need to get on the waiting list because the waiting lists are really long for those kinds of facilities.
Wonderful. Thank you. We're going to go to our first question. Would you please introduce yourself and try not to tell us too long a story about Grandma?
Hi, Jane. I'm Carol McGuire. One of the most powerful lobbies in the state of Ohio over the past several years has been the nursing home lobby. This is not going to be a delicate question. And they've exerted what I consider to be undue control over many of our legislators who tend to have the nursing home live in their pocket in terms of funding and lobbying expenses. Recently, I've read where some of that's begun to crack a little bit and that there's been greater awareness of the efficiencies of alternative care, such as what you've just been discussing. So what can we, as citizens and healthcare consumers, do to assist our state legislature in understanding how critical it is to examine the assets and where they're going?
Well, let me, there's a lot of questions there, but I would say one of the issues related to nursing homes is that the cost of a nursing home is primarily labor. And so you mentioned the nursing home lobby. We realize how expensive it is to operate the nursing homes. And what I've seen with the Kasich administration and some of the leadership there has been a movement in this state to move away from institutional care into more home and community-based services. A support for adult daycare, support for affordable assisted living. And I think that support for all of the continuum of care related to home and community-based services, that's the answer, is more diversity of lower cost solutions. While there's certainly a number of people that must need a nursing home and they need to be supported in a way where you can provide quality care, there's certainly a lot of approaches to a lower cost care, housing being one of the best, I think. So.
Great. Next question, please.
Good afternoon. My name's Charlie Rodenfels, and you've touched on a few aspects of funding for this care, senior care, health care, and we all have some of that responsibility. Government subsidies are there to help shore up some of that responsibility. I'm very interested in where you think faith-based communities are participating, whether that's a growing trend, whether that's receded dramatically. Where's the faith-based mission for this senior care headed?
I'm going to tell a story. You good with that?
Yeah.
So Fred Ricketts runs out of money, and he's living at First Community Village. What happens? Not-for-profits say, Fred, stay put. We'll take care of you. For-profits say, no pay bill, get to leave. The big difference between the for-profit and the not-for-profits is we're committed to that senior till the dying day. And I can tell you it made a difference in my life. Amazingly, my dad received his confirmation to be on Medicaid on the week that he died. He never actually drew a penny of that subsidy. But that is the challenge that we have. We, at the not-for-profit world, we consider serving the people, the haves and the have-nots, exactly the same. And I would tell you there is a shrinking number of us, of the not-for-profits that are in this space. And the strong lobby that I think it was Carol that was speaking to is the for-profit lobby for nursing homes. We are diverse. We plan to serve that senior wherever they live. Nursing home is one of those areas that we advocate for, and we do think the reimbursement could be improved. But we're seeing threats on reimbursement for every resident that comes in. And 70% of the people that live with us have run out of money. 70% in a nursing home. 66, I'm rounding up, but it's a large number.
Wow. Great. Next question, please.
Good afternoon. I'm Cynthia Gerst, and I work for the Department of Transportation, as they well know. I'm on the board. Could you talk a little bit about the transition? So we talked about healthcare and about affordable housing, but transportation is a very important part of life. And when you think about your quality of life, how do you get these seniors to cultural events, to doctor's appointments? I mean, a lot of seniors, as they need to go to housing, lose the ability to drive. So location of of your services and all of that. Could you talk a little bit about transportation and that impact on our seniors?
Well, I'll start and let Mark kind of pick this up. We have the largest, I believe, transportation fleet next to CODA and the
Next to
school
CODA,
systems
yeah.
in the city, and it really is important. We're finding as we work now with Molina and Aetna, who are now charged with taking care of the dual eligibles in Franklin County, that one of the big issues they see is transportation, getting folks to the doctor's office, and I would tell you that's it's vital and one of the things that we really invest in.
I would tell you, senior supports are the barriers to good health and good living sometimes are not about dollars. And so we spend an awful lot of our time engaging seniors on how to live their life better. Much of that is the barrier of transportation. If you're now 91, you can't drive anywhere, you begin to feel like you're closed in. Our best retirement communities, where we have 11 campuses that are market rate, we have private transportation any place they want to go within a 15-mile ring. In affordable housing, it's a little bit more limited. We bring a lot more in. They're living congregately, but I can tell you access to health care, access to socialization is a big deal.
We certainly welcome them to come to the Columbus Metropolitan Club on Wednesdays. They add a great deal of wisdom. Emmett?
Good afternoon. Tom and Mark, fabulous program. It's great to hear from you. My name is Emmett Kelly. I'm on the board of CMC, and just a pleasure to have you here, so thank you. You had touched on the services that you provide to veterans, and can you expand on that and where you see that going, especially with all the talk on the challenges that the VA is having now?
Well, I am a veteran, as somebody, I guess Jack pointed out, and so it really is near and dear to my heart. There are 59,000 homeland veterans today. In my mind, that's a disgrace. And our board, in one of our strategic planning sessions, said, is there anything we can do about the veterans problem and a homeless problem? We've been able to sponsor with the Housing Authority and also with the Veterans Administration and support from the county and the city and everybody else to bring the Composite Livingston here, which is now housing 100 veterans. And we have case managers in place. We also have job training specialists in place, and we have veterans health care in place. And I do believe, you ask about where it's going to go from here, I do think the country is paying more and more attention to that. We have now one under development in Toledo, one under development in Atlanta. And I think sometimes when people hear the story, they're saying, this should not be. Again, supportive housing is typically a mental illness issue, 73%. And veterans are prone to that, especially coming out of combat situations. So I think we're going to see our government being more favorable towards supportive housing for homeless veterans, and we're hoping to be a big part of that.
Thank you, Tom, for all the work you do with the seniors. I appreciate it. Fran Ryan, and I'm the advocate for the Mayor's Office for Seniors and Central Ohio Office on Aging and Franklin County Office on Aging. And I've been working with National Church Residency now for a couple of years. I think one of the things I'd like to get good news, which is our collaborations with all of the agencies. We now have, I now have almost 900 members of the Senior Services Roundtable. So there is a collection of agencies now that we talk and get together so that we can share some of the things that you have talked about, particularly housing and transportation. But one of the things that is unique, I think, that's coming around in the country is the Village Connection system. And that started out in the East Coast, and I have to say that we have one in Columbus now that is thriving, and our members are increasing, and we're getting out. And that's to provide social services and agency helps for people living alone that may not have a family here, but we can provide that input so they can stay in their homes longer and get an advantage of all the services that we have. So those are the kind of things I think that cities need to look at. And I think the other thing we need to look at is the priorities. With the tsunami coming and with all of us who, speak for myself, will be 81, I think that those services are necessary, and we need to think about seniors taking the bus, taking the C-bus, going to the theater, having fun, staying down, having a choice. And I think those choices are kind of what we're trying to do in the city. So I just want to thank you for your services.
Wonderful. Thank you, Fran.
Hello, my name's Greg Lonsway, and I've been honored and privileged to served with faith-based nonprofit organizations in long-term care in Texas and Ohio for the last 3 decades, and I just want to have one comment and one question. I want to echo on Mark's comment about we take care of folks until the very end, and that's something I'm very proud to work in the field of aging services, because we have a choice: either lower the quality of care to meet the reimbursement rate from Medicaid, or we can make it up through gifts and contributions and talk about how we are a worthy organization to serve seniors and those that are not in a capacity to provide financial support for services rendered. My question goes to Tom, and I ask you, Tom, in all due respect, what do you see with the advances of technology, its role in the future of maintaining independence and providing a safe environment for seniors in the community?
Yeah, I think it's a big deal. I'm a member of organization member of Leading Age National, and we have a institute around technology. And one of the game changers we think could be technology and technological support for folks as they age in place, particularly at home. So being able to provide lower cost, better care at home, we think there's lots and lots of room for innovative solutions there. We also see it in healthcare. We think that there are technologies coming along in institutional residential healthcare, such as devices that can tell when a nurse aide walked in a room what they did, and ways that provide better efficiency for your staff. So I think there's potentially a big breakthrough as it relates to technology with lowering the cost and improving quality of healthcare.
Our board of directors just provided to us some resources for the next 5 years to advance the triple aim, I guess we would call it in a cultural setting. What we call it here is safety, reliability, quality, and at a lower cost. And the question is, can all that be done? And so we're going to spend the next 5 years doing nothing but studying ourselves. How do we achieve the triple aim at National Church Residences? And I don't believe we have exhausted all the innovation that's possible in order to have health care happening, whether that's in your home, or it's an assisted living or a skilled nursing center. I don't think we've exhausted all the ideas. I think we're just getting started.
We're going to take one last question, sir.
Tom and Mark, thank you for coming today, and I think this has been a great event for us to learn a lot about. Greg Anderson, Skylight Financial Group. One question, I got 2 questions. Number one, other than what you're doing here today, what are you doing to educate us baby boomers in purchasing long-term care and what we should be doing? And then second follow-up question, is there anything being done at the government level to make long-term care premiums tax deductible?
Well, just to let you know, there are lots of thinking around that. The meeting I mentioned in Washington was just exactly about the way we finance long-term care for seniors going forward. Our organization is part of Leading Age nationally, and we have an institute around that topic. Our board contributes to that research effort, and it's something we've got to get the word out. There's got to be some support for those of us that can afford long-term care insurance to get it, so we don't go through the crisis that Mark's father went through. And there's got to be some support for lower-income folks that they can also advance their long-term care planning through some kind of insurance product. Both those underway. There's educational programs underway. There's advocacy underway with our policymakers. It's a big deal in terms of solving this twin problem of demographics and economics.
And I'll take it as a personal challenge about how we educate everybody, because I do think that we're missing a boat there, don't we? We all put off the learning of that until we've hit a situation with our parents or in our own lives, and we go, hey, what is the Medicare and Medicaid meeting in, and what's these parts? So I think it would be really wise for us to open that forum up and start teaching.
Wonderful. I'm going to turn the stage back to Julie to conclude.
Yep, what a terrific program. Thank you so much. We encourage you to continue the conversation with coffee and cookies out in the lobby. And remember, you can view this and all of our other forums on CTV Columbus Television and on WOSU and PBS affiliates statewide through the Ohio channel, and anytime on our website, columbusmetroclub.org. There's a link to YouTube. Thanks a lot to Cornica Cozing, Porter Wright, and the Dispatch. And thank you, Tom, Mark, Jane. Hope to see you again soon. Thank you.